Now, let's take this discussion further, and we're now being joined live from Maryland, United States, by a research professor and consultant at the Nigeria Institute of Medical Research, Professor Richard Adegbola. Thank you for joining us, Doctor. Good evening. The health sector globally took a hard hit in 2020. How devastating was this in Nigeria?
Oh, thank you for having me. It's obviously a global issue, the pandemic. Having had about 84 million now actually cases globally, with 1.8 million, over 1.8 million deaths. In Nigeria, as you know, the numbers are in the neighborhood of over 88,000 cases and 1,294 deaths. But the one thing to say straight away is the fact that we are under testing, as you know, and therefore under reporting. And from your report, actually, I've had the mention of second wave, and I just wonder whether what are we talking about, really? Because we are 200 million population in Nigeria. As you can see from the efforts from NCDC on their website, we've only tested over 900,000 samples. That means really we have tested less than 1 million samples from 200 million people, far less than 0.5%. So I'm not sure that we can begin to talk about second wave. The more you test, the more cases you see, and that's, I think, what is happening. I think what's essential now is to make sure that we adhere to the non-pharmaceutical measures of protection, hand washing, avoid crowded places, social distancing, using face masks and whatever, to make sure that we actually don't expose ourselves to getting the virus. But this has really affected Nigeria, not only in the life and the living, but also the economic impact. As you know, the lockdown actually put many people out of jobs in Nigeria and elsewhere globally.
Professor, now, with all that you've said, to what extent has all of this exposed the state of the health sector? I'm asking because of the high number of healthcare workers that have died, the high level of brain drain in the healthcare sector, and looking at everything that has happened.
You will recall that the President, His Excellency the President, did the right thing, actually appointed a presidential task force to combat the pandemic in Nigeria. And in their first report, they actually rightly said that the healthcare system in Nigeria, because of its status, cannot cope with an exponential increase of the disease in Nigeria, and rightly so. So it's not surprising that because of the status of our healthcare system in Nigeria presently, our gallant healthcare workers in the forefront of these issues were obviously exposed and paid the price, unfortunately. And then you can see the consequence and complication of that actually moving forward. It was also mentioned in the report that the fact that the pandemic is raging on in our country, the routine immunization program is also already getting affected because of missed opportunities and because they are not able to take the vaccines as scheduled. That means, unfortunately, that even when the pandemic is over or while it's still going on, we're going to have more deaths from vaccine-preventable diseases, for which we normally expect children to be protected. But it's not so. We have to also mention here that it's not all bad news. The good news on the horizon is that there are now vaccines that are being given emergency use authorization. at least 2 of them, and the third has been approved again recently in the UK. So there is hopefully light coming on at the end of the tunnel that in this new year, at some point in time, there will be vaccines available. What we need to do in Nigeria now is to start preparing now so that when the vaccine is available, we'll be able to deliver them. We know that globally there's a plan to make sure there's equity in access, but equity in access is different from equity in delivery. So are we going to start learning from our past mistakes or what is happening now to make sure that we get our healthcare system ready in terms of the platform to deliver the vaccine when one is available?
So, Professor, with all of this now, where do we go from here? What do we do to keep Nigeria's health sector alive in 2021 and beyond?
Look, I will start with saying a common quote that says, if you want to solve a problem, study it. Research is the key for many of our problems and potential solutions in Nigeria. We shy away from data. And again, that's why we're talking about first wave and second wave and what have you now, when we don't actually have the baseline. So we need to spend more money on research. We need to learn from the mistake now. What have we done right? What have we done wrong? Because there will always be another pandemic. This is not the first one. This is not going to be the last. And we're having epidemics of other diseases, as you have mentioned in your report, in terms of yellow fever and even cholera, which is sad to say in our country at this time and age, disease that has disappeared completely in other settings. We need to agree on what we want to do with our healthcare system. We need to encourage joint or collaboration with partnerships and partnership with other stakeholders, public sector, government sector, NGOs, working together to identify the problems and provide clear, measurable solutions that we can actually put together to address the problem. Nigerians are capable, and we have experts that can do this. What is holding us back? I think it's putting the right leadership together to identify the problems, provide the solutions that are measurable, and get set to actually resolve them.
Finally, how do you think the country can tackle the challenge of brain drain in the health sector?
Well, that's a big question. You can see the answer is not easy for me to prefer. If you have to provide the right working environment for people, you have to provide equipment for them to do the tasks that they are charged with to perform. You cannot have the best. So Nigerians send our doctors to the US, to Europe, and what have you, to train in the best possible with facilities, and then they come back home and they can't actually function because you don't perform in a vacuum. You need a platform in every area, actually, of our endeavors to function. And I think it's not only in the medical area, it's in the other areas as well. We need to, I'm not sure I know how we can make progress without funding education properly and without attending to our healthcare sector. Making sure that we actually meet the globally set to which Nigeria actually agree as a country, the minimum amounts regarding our GDP that we need to spend on education and healthcare sector. And until we begin to do that realistically, the government can try, but we may not be able to make the mark until we begin to put our money where it will yield the kind of result that we are seeking.
It's been an interesting conversation with you, research professor and consultant at the Nigerian Institute of Medical Research, Professor Richard Adegbola. Thank you for speaking with us on the news at 10, and we wish you a happy new year.
Thank you. Happy New Year. Thanks for having me.